Welcome to the Oxygen Alliance YouTube channel, where we bring you videos on installation, maintenance, and various trainings on oxygen equipment and devices. If you have comments and or questions, drop them in the comment section below or write to us info@oxygenalliance.org. Remember to like our videos, subscribe to our channel, and hit the notification bell.
Greetings everyone, welcome to another talk brought to you by Oxygen Alliance. My name is Sambo, your host for today. I'm joining you from Lilongwe, Malawi, and would also like to know where you're joining us from, and please drop your name and location in the chat. You can also drop your emails in the chat to receive exclusive emails from Oxygen Alliance. Today's topic will be understanding patient simulators with our lovely presenters, Aubrey, Chinkunda, and Janet Douglas. So at the end during the call, we have a very, very exciting news. So please stay tuned to hear this exciting news that will be brought to you by Oxygen Alliance for biomedical engineers and technicians. So please also don't forget to take a notepad to take note of your questions that will be attended to at the end of the call. And also we'll have a live demo on how the patient simulators are used. I'll now hand it over to our presenters today, Janet Douglas.
All right, welcome everyone. As the host, Claudia has said it, my name is Janet Douglas, a biomedical engineer at Oxygen Alliance. So I will take you through the first part of the presentation, and then Aubrey will finish it up. So in this presentation, we're going to have an introduction to patient simulators, their types, the technical overview, the factors that are considered in selecting these patient simulators, the device accuracy, simulator testing and maintenance, as well as they will have a live demonstration at the very end of the presentation. Patient simulators are coming in because we have patient monitoring devices. So these patient monitoring devices are devices that are used to measure the patient vitals, such as the body temperature, the oxygen saturation, the blood pressure, the heart rate, the respiratory rate, as well as the electrocardiograph, which is known as ECG in short. So the patient simulators are needed to test the functionality of these patient monitoring devices by providing electrical or optical signals, which are similar to those from a human being. So as you can see in the picture on your right, you see that you have a patient simulator, and then this patient simulator is actually generating physiological signals, which are then displayed on the patient monitor. So the patient monitor here is actually showing the results that are being taken from the patient simulator. So you can see in this case, this patient simulator is acting as our patient, as we're able now to navigate through and even see maybe how the patient would perform if we try to give the simulator some parameters that would be taken from the body of the patient. So why patient monitoring device testing? We need to test the integrity of these devices because we want to run away from getting inaccurate readings or results. And also it is very helpful when it comes to the healthy personnel, let's say doctor or nurse, when they're they're monitoring the patient and also giving treatment so that they do not give the wrong treatment. So it also helps us to know not just the integrity of the device itself, but also other accessories that comes from with it. If you talk of, let's say, the sensors that are used for the oxygen saturation, you talk of the SpO2 sensors, for you to know if they're working properly, even any part of the device itself, you have to check the integrity by using the patient simulator. So it's very important because we actually address any inaccuracies or malfunctioning of the patient monitoring devices that you might have either in your hospital or at any facility where you're using these devices. Now, we as biomedical engineers or biomedical technicians are supposed to take a step forward. When you're planning for your plant preventive maintenances, you also have to put into consideration to check the performance of these devices. We are supposed to be conducting performance tests at regular intervals. You can do safety tests. When it comes to safety tests, mostly we look at the performance of these devices because actually if you don't test their performances, you put a risk to the life of the patient and even the integrity of the user itself. And also we have to try as much as we can to check the parameter accuracies, the alarms that are there, if the alarms are there to beep or they're able to beep when there's a need for them to do so, among other activities that you can do. So moving forward, I'll take you through the types of these patient simulators. So mainly we're going to look at 3 types. The first one is the single parameter simulator. So it actually simulates one specific physiological signal. So you can either, I'll give an example of an ECG simulator. This one will specifically look at simulation that will mimic the heart electrical activity by generating electrical signals which are similar to those produced during cardiac cycle of a human being. And as you can see in the picture on your right, you see that we have the simulator, and then it has leads or connectors that will be placed on a monitoring device. So if you're checking your ECG on a patient monitor, for example, you have to connect it to the patient monitor, and then it has to show you the results. You can also have an SPO2 simulator, which is there to simulate the oxygen saturation. So the results that you get from these simulators are supposed to be compared against the results on your monitor. So in the cases whereby you see that the results are the same, we would say that the monitoring device is working perfectly. In the cases whereby you see what you have said on your simulator is very different from what you're seeing on your monitor, these are the cases whereby you would say maybe something is wrong, and then you start troubleshooting. And for the SPO2 simulators, you can see that it comes along with a simulator probe in the picture. So the simulator probe has an arrowhead where you actually connect it to the patient simulator itself. And secondly, we have a multi-parameter simulator. So these are simulators whereby you can be able to it can be able to replicate various physiological signals. For example, you can use it for simulating ECG, the SPO2, the non-invasive blood pressure, the body temperature, the respiratory patterns, just among others. So you can have a couple of parameters that you can try to check from a single simulator. Finally, we have a maternal or fetal simulator. These are specifically for fetal heart rate, as well as uterine contractions for obstetric monitoring. So for pregnant mothers, or even for checking of the condition of the fetus, you use these type of simulators. Now, we'll look at the major components of patient simulators. So in each and every simulator that you see externally, you have a keypad, and you also have a display where you'll be able to see the results. And if you're looking at a multi-parameter simulator, you definitely have ECG connectors, because ECG is one of the parameters that you find in a multi-parameter simulator. And every simulator also has a charging port, because they use rechargeable batteries. And also you can have other outputs. So the output ports, you can connect other parameters, like for the body temperature, or if you want to assess the non-invasive blood pressure. These are the ports where you use to connect those probes. And then moving, looking at the internal parts, mostly when you open it, you will find 2 boards. There's another board for the LOCD, and there's the main control board that is responsible for controlling all the activities that happens within. And if you try, let's say you're trying to navigate through the simulator, this is the board that actually controls everything. And also you have a rechargeable battery inside this. Now, I will take you through the technical overview or an understanding of how these simulators actually work. So they rely on combination of hardware as well as the software to generate accurate physiological signals that I've been talking about. And these signals are received by the patient monitoring device as if they were coming from a real patient. And the software that is inside the simulator, they use predefined or adjustable parameters to create signal representations of the physiological signals. So what it means is when you have your simulator, it gives you the right to adjust the parameters that you want. For example, if you want to test the functionality of your device or your monitor, let's say the patient monitor, and then you're trying to check if it's able to read the heart rate of the patient at 70 beats per minute. You can set the 70 beats per minute in your simulator, and then you try to check if it's also going to show you on the monitor itself. So these are the things that you would actually see. And then to just go into details, the first thing that you do is to connect your simulator to the you connect your monitoring. Firstly, you connect the monitoring device to a patient simulator, and through the standard cables and connectors that I showed you earlier, you can be able to do the connections. And secondly, what will happen is once it has been connected, that physiological signals will be sent to the connected device. So the signals are just like I already said, you can adjust or you can choose to use the ones that are already there. And then the monitoring device will then start picking these signals and it will display the readings. And it may even trigger some alerts on your monitoring device, because let's say if the body temperature that you had to set area was at, let's say, 26 degrees Celsius, and you know that the body temperature of a patient is supposed to be around 36 and 7 degrees Celsius. It is supposed to give you an alarm that the condition that the patient is in is not okay. So you should be able to do that. And this will actually help us test the accuracy and the responsiveness of the device itself, as well as the simulator, if it's able to adjust to those conditions. Now, finally, navigating through the simulator itself. First, you see the simulation. So in the simulation, it doesn't matter whether you're using a multi-parameter or a single parameter, but then you should be able to test different parameters. So you can, for example, if you're talking of a multi-parameter, you should be able to see where you can simulate the ECG, where you can simulate the respiratory rate, the respiration rather. And if you're talking of, let's say, for an SpO2, you should be able to see where you can manually set what you want, where you can also be able to set the values and see how the monitoring device will respond when you add some different lighting. Let's say the ambient light, you change it to a certain frequency or you put it at a normal level. You should also be able to simulate all those things. It will also have alarm limits, whereby you use this part to actually test the reaction and time of the monitoring device, as well as it will show you the efficiency of the device in monitoring abnormal patient conditions. So like I was saying before, it should be able to give you alerts, and the alarms are supposed to be activated the moment they sense some malfunctioning. And also you will see amplitude. So when it comes to amplitude, it is just there to check the height or the strength of a physiological waveform. So if you're talking of an ECG, let's say the blood pressure, and mainly this amplitude is important because it allows you to be able to check different conditions. Let's say if you increase amplitude, it will bring in some noise in the signal. And if your monitoring device is able to still give you the recommended results, in as much as you increase the amplitude or you decrease the amplitude, if it's still giving you the same results, it means your monitoring device is working properly. Because this comes in because there are cases whereby you have some patients who have very serious conditions, and then you have other patients whereby their conditions are not that serious, or maybe their body condition is actually working normally. And if it's not able to compensate in those or in all those conditions, then there's something that is wrong with your monitoring device or even the simulator itself. And apart from that, you have an error curve. So error curve is mostly found in SpO2 simulators, and this actually calculates the SpO2 level based on the amount of light being absorbed by the blood. You know, when it comes to oxygen saturation, you talk of infrared and red rays that is being absorbed by the blood itself through the tissues. So it compensates for factors like the skin tone, the tissue thickness, and as well as the light scattering. So it shouldn't matter whether you have light skinned or you have dark skin, or whether there's dust or something else, it should still give you the required results. However, these error curves are preset. Every monitoring device, when you talk of SpO2, it's supposed to have will come with its own error curve. And when it comes to the simulators actually also come with the error curve, so that you should be able to match. But then in the cases whereby you don't even match the error curve from your simulator and your monitoring device, which is a pulse oximeter, you should still get the same results. It's not supposed to give you different results. So which means that the error curves can actually differ based on the pulse oximeter brand or the sensor type that you're using. But in all these cases, you're still supposed to be getting the same results if your device is working perfectly. And you also have the settings whereby you can change the language, the brightness, the data source, or the timeout. On the data source, it's because sometimes you can use an SD card or a memory card to get the data and then be able to simulate it. And before I hand it over to Aubrey, I'll look at the factors that you need to consider when you're selecting a patient simulator. First, you have to understand the type of monitoring system, whether it's a single use or a multi-parameter. If you need a multi-parameter simulator, it doesn't make sense for you to purchase a single use. And also, you also have to understand the test requirement, whether it's for calibration or performance testing. And also, you should know that you should be able to use your device or your simulator. So you have to choose something that is easy to use, and also something that you should be able to navigate through the interface and the connectivity itself. And also you have to consider the simulation accuracy and performance, whereby you're looking at signal fidelity, the time response, and calibration. When it comes to signal fidelity, what it means is it should be able to detect all the signals and give out accurate results. Finally, you look at the durability and maintenance. You cannot buy something that you shouldn't be able to maintain. You should be able to maintain it, and you should be able to stay with it for a longer time. So this is all I had for you, and reaching this far, I'll hand it over to Aubrey. Thank you very much.
Thank you very much, Janet, for the presentation. So I will take us through the next part of the presentation, where we're going to look at how the patient simulators enhance monitor accuracy in the hospital or various health facilities. So one way that patient simulators enhance accuracy with the patient monitoring devices is because they allow us to perform testing, to conduct performance testing and validation. It's going to help us ensure that the monitoring devices are working properly. As Janet has already mentioned in a part of the presentation, that you can be able to simulate various conditions and various scenarios using the patient simulators. So, for example, you can check various ranges when it comes to let's say the SpO2 or even the heart rate and other parameters. That way you can test through a vast set of scenarios, and this can make the test very efficient because you cannot miss anything. That will help you validate that the monitoring device is actually working in each scenario. And while conducting these performance tests, you ensure that the monitoring devices are really staying compliant to the health standards and regulations, which is very important to ensure that you are delivering the appropriate services to the patients. And the patient monitors can also help in troubleshooting and problem solving. They help us to diagnose equipment functions efficiently because you can be able to simulate different scenarios, as I already mentioned, and it will also reduce downtime, because if you're conducting performance tests and you're not waiting for the device to fail, you can pick up any faults before the device actually fails or before the device actually malfunctions, maybe even while it's connected to a patient. So when you're conducting routine tests, you can be able to pick up on issues earlier and reduce downtime. And enhancing troubleshooting efficiency through real-life scenarios and simulations. The patient simulators come with different scenarios. Some even have preset conditions, like, for example, tachycardia. It will simulate what the SpO2 and the heart rate is going to be for a patient who's having that condition of tachycardia. So you can be able to test various presets and really make sure that the monitoring device is working. So now that we know that patient simulators enhance accuracy, how do we integrate these into the clinical setting? One way is by including them when we're conducting the routine testing and maintenance. We need to make sure that we test the patient monitoring devices and not just assume that they're working, just by looking at the numbers. So if it's displaying parameters or numbers, you really need to make sure that the numbers are correct. So this can be done by incorporating the patient simulators in routine testing and maintenance. They can be integrated into preventive maintenance schedules to reduce the risk of unexpected equipment failures, because you can pick up any issues or any faults earlier before the device malfunctions. And when conducting the routine testing and maintenance, you need to make sure that you are documenting everything So it's going to support in accreditation and audits. It will help to verify that patient monitor accuracy, ensuring compliance with regulatory standards. So whatever test that you do, make sure you're documenting it. So if maybe somebody comes to check if your devices are compliant, you can always show them the documents that we did this test on this day and these were the results. So make sure you keep the detailed reports that can be generated from what the test that can be used to support accreditation and audits. And also, since you'll be conducting routine testing and maintenance, and every time you conduct a test, you're supposed to document it. When we're documenting, that means we're keeping data. So this data can be used to monitor the type of monitoring device. For example, if you have a certain brand of a monitoring device and you, through your test, you're able to see that this brand fails frequently because of that data that you're constantly collecting. Next time when you're doing your purchase, maybe you might consider switching to different brands because of that data. Now you can see a trend or a pattern that, okay, maybe this brand usually fails because of this problem. So continuous improvement and accountability. Because of the data that we have, we can be able to make some decisions that would be helpful for the health facility. Some of the problems and the solutions that you might meet when you're using patient simulators, when you're trying to measure the SpO2 of the patient, you need to make sure that the probe is connected to a pulse oximeter. So if you don't connect the probe, it's going to give you a prompt that no red LED or no infrared LED. Or if the probe is damaged, you also get this problem. So if you notice that you're getting this error on the display, you can just make sure that the unit is placed properly and also check the probe if it's damaged or not. The other problem is failing to power on. If you notice that the device is not powering on, you need to check if the battery is charged, because as Janet said, most of them come with a battery inside, so you need to make sure that the battery is charged. Most of these devices have an LED that will show if it's charging. It's usually going to be red, and once it's fully charged, it's going to show a green LED. So you need to make sure that it's charged. If the battery is fully charged and it still can't power on, then it might be a bigger problem that something is damaged with the device or the board. So you need to check that as well. If the display disappears suddenly, you also need to check if there is further damage, or also check the power with the battery. And also if the battery is not charged full for more than 12 hours, so you leave the device on the charger for more than 12 hours and you notice that it's still showing the red LED, that definitely there's something wrong with it. So you need to check if the battery is damaged and try to replace it and see if that works. So those are some of the common problems that you might meet when you are dealing with the patient simulators. Now let's look at some of the best practices that we need to follow when we are using the patient simulators. There are a lot of best practices that are out there. Apart from these that have been listed, I think one thing that I would advise all the engineers and technicians on this call is to always follow the guidelines or the recommendations that are there in the manuals. So because different brands will have different recommendations and different guidelines. So that's the most key thing. Make sure that you read the manuals, the service manuals and the user manuals, and any recommendations that are there, make sure you're following them to ensure that the patient simulators work properly. So the first one is to calibrate the patient simulators regularly and check before you conduct any test. You need to make sure that the patient monitor simulator is working properly. And after you've checked, you need to have standardized testing protocols for all the engineers or technicians, because in the case that you have multiple engineers or multiple technicians at the site, you need to make sure that everyone knows exactly the exact steps to take when they're trying to use the patient simulator. That way, it will help you know that the results that you get are the same disregarding the engineer or the personnel who was conducting the test. So you need to have these standard operating procedures for testing. When you are doing the testing, make sure you simulate diverse patient scenarios. Don't just go there and just, let's say, set the SpO2 to 90 and the heart rate to 65, and then you're done. You need to simulate various scenarios to make sure that the test is efficient, because one scenario might work and one scenario might not work. So you need to make sure that you test the various set of scenarios on the simulator. Make sure you record and track the results consistently. These are very good for, as I said, accreditation and audits, and also reporting. Make sure you track and record everything. It's something that will also help if that device maybe malfunctions in future. You can always have a history that, okay, we serviced this device like 3 months ago and this was the problem. So it will give you a starting point. Make sure you train the staff regularly to ensure that everyone is up to date. Make sure you also update the software and the firmware inside the device. You always want to have the most updated software, because the new versions always come with better and improved features. So these are some of the best practices that we can follow when you're using patient simulators. This is the end for my part. I'll hand it over back to the host before we get into the live demo. Thank you very much.
Thank you so much to our presenters for the day. As we are waiting for the live demo, I would like to make the announcement that we've been waiting for. All right, so the announcement that we've all been waiting for as Oxygen Alliance, to let everyone know, is that we're officially launching an application for biomedical engineers and technicians, which is being called Biomedical. This application is a community, or it enhances the building of a community of biomedical engineers and technicians, because it will allow biomedical engineers to interact together by asking questions and also answering questions. So if you have a question, you can ask on the application and we will be able to answer you. And also it has a number of resources where you can find manuals for oxygen concentrators, maintenance videos, and
hello, I hope you can hear me. Katie has just lost connection, but as she was saying, that we are launching the BME Concept app on the 20th. So if you want to receive the notification that we have launched, you can just paste your email in the chat. So be on the lookout for this launch. Yeah, it's an exciting app, and it will be helpful to you as biomedical engineers and technicians. Thank you. So as we were waiting for the live demo of the of this presentation, yeah, you can be pasting your emails in the chat to get this notification.
All right, welcome everyone. I hope you can hear us. So at this point, we would like to demonstrate how we can operate these patient simulators. So currently we have 2 multi-parameter patient simulators, and we have one SpO2 simulator. So Aubrey will start, and then I will come at the end.
Yeah, so this is the SpO2 simulator. This one by here, it's actually written on top. This is the MS100 patient SpO2 simulator. It's designed by Contact Medical Systems. So in the box, you have the main units, you have the Pro, which is this one, and then you have the power adapter, which is this one. So this is used for charging. So these are the main things that you have in the box. I'm just going to finish this by the side. So first of all, you have these different keypads. Before we get to the keypads, you have this port where you connect to the probe. Then you have this port where you connect the power adapter. If you want to power it on, you press on the power button. Click that, it's going to give you a welcome prompt. It's also going to show the type of power curve that you are currently on, and then it's going to give you the main menu, which was presented earlier. You have 6 main options. When it comes to this SPO2 simulator, you have the simulations, you have the alarm limits, you have the amplitude, you have the presets, the settings, and the power curve. So before you go into the simulations, you need to make sure that you've connected the probe, which is this one over here. So the probe looks like this. So you just fit this to the ports, make sure it fits properly. And then you tighten, you screw it in. So we have our probe connected now. We're going to go into the simulation so that we can see the type of simulations that are there. You use the arrows for navigation. So we are already selected on the simulations. You click OK, and it's showing that. So this is one of the problems that I was saying. You need to make sure that the probe is connected properly. Going to reconnect this. Yep. So yeah, I reconnected it, and now we have the 4 different simulations that are there in the SPO2 simulator. You have the manual, the ambient light, the TLC, and the auto test. For the manual test, as the name suggests, you manually set the values or the parameters for the SPO2, and this SPO2 is going to mainly monitor 2 parameters, the pulse oximetry, the SPO2, and the heart rate. So you can, once I click OK, you have 2 options. You can set the SPO2, and you can also set the heart rate manually just by using the navigation arrows. You can either decrease or increase it. So I'll just go back. So let's try to connect the pulse oximeter and try to see if we can do the manual test right now. So this is the pulse oximeter that we have. I'll switch it on. And this is the probe for the pulse oximeter. I'll put the probe into the pulse oximeter. Make sure the probe is placed in the right way. And make sure this part is facing where the light is coming from inside the probe. I'll place it like that. And we have connected everything. So right now we're going to do the manual test. So I'll select the manual test, and right now the SPO2 is on 90 and the heart rate is on 75. So ideally, you also want to see the same values on the pulse oximeter that you have, and which is what we're getting. We're getting 91 for the SPO2 and 75 for the heart rate, which is okay because they usually have a tolerance, which is also indicated in the manual, but it might be somewhere around minus or plus 1% or something like that. So it's advised that you check the manual and make sure that whatever values that you're getting is within the recommended tolerances. We can try to change we can try to change the SPO2. Right now it's at 75. We can increase it to 80, and you click OK. And then you also need to see how the pulse oximeter is behaving. Right now, the pulse oximeter is also going to 80 and 81. So the readings are okay. So that's the manual test. I'll just quickly go through the other simulations. You also have the ambient light where you can simulate different lightings. This is to simulate different rooms. So if you're in an operation room or you're in another room, you might get different lightings in that environment. So you have 4 main options. When you click on the ambient light, you have the norm, the 60 hertz, and the sun. So these are the 4 different options when it comes to the ambient light simulation. Then you also have TLC, which stands for translevel control, because using the patient monitors, you're going to use it on different patients with maybe various skin shades, maybe different sizes when it comes to the finger. So the translevel control just tries to simulate different conditions. If let's say the patient has a large finger that is fitting perfectly on the probe and also has a small finger that is not, making proper contact with the sensors. Ideally, you still want to get the same value. So this just tries to mimic various conditions when it comes to the patient. And finally, we have the auto test. For the auto test, as the name suggests, it's an automatic test. You don't have the option of setting the values when it comes to the SpO2, their presets. And getting back to the main menu, alarm limits, as it was already mentioned, that you can be able to test the various alarms when it comes to the monitoring device. I will go to the amplitude, where you simulate the strength of the signal that you are getting from the monitoring device. You can, right now it's set to 3, but you can increase or decrease it depending on what you're looking for when you're conducting the test. So it just helps you again to simulate the different conditions. Some patients might be able to give you a stronger signal with a bigger amplitude, others might give you a weaker signal. For the presets, for this SpO2 simulator, it has different conditions. For the patient, you have like an obese condition, you have the normal condition, geriatric. So it has like preset conditions that if the patient is obese, usually the SpO2 is going to be around these ranges, and then it will simulate that. So you need to make sure that you are testing the monitoring device across various scenarios. So this has multiple scenarios, multiple conditions. And finally, we have the settings where you can change the different options, languages, even the data source, as Janet mentioned, if you're using an SD card. And you also have the R curve. The R curve, you can select whatever R curve you use. This SpO2 simulator has 8 R curves. So you have to, the R curves are responsible for the accuracy and also even the speed of, the speed that you get the results for the pulse oximetry. So you need to make sure that you're using the right R curve. You need to test the pulse oximeter across different R curves. Currently, the R curve that we're using, I think it's the Massimo R curve, which I noticed when I was testing the device. I noticed that works better. But when you go to other R curves, you might get different results. Right now, we've changed from the Massimo, we've gone to the PMS M1190. And if I go back to the manual test, I click OK, we're supposed to be getting 92 for the SpO2 and 95 for the heart rate. And right now, the SpO2 is on 88 and 95 on the heart rate. So you can see that maybe this might not be the best R curve that you want to use. So always check that you are using the right R curve. If you're not sure, just make sure you test across the various R curves that are there in the SpO2 simulator. So those are the main options when it comes to the SpO2 simulator. Some of these options might not be available in other SpO2 simulators because they're made by different brands and different manufacturers, but surely you should find different types of simulations and the R curve. So that's it when it comes to how to use the SpO2 simulator. If you want to power it off, you just click the power button and it will shut off. So that's it when it comes to the SpO2 simulators. I will hand it over to Janet talk about the multi-parameter simulators.
All right, so when it comes to the multi-parameter simulators, firstly, before I demonstrate how this works, I would like to make everyone understand that you will find different models and brands of the simulators. In whatever it is that the navigations of the ones that we're going to show you, it doesn't mean that every simulator like you see, that's how we can go through the navigations. But I just want us to at least understand a little something and be on the same page in case we encounter. So in our case, when it comes to the simulator, I once said every multi-parameter simulator will have an ECG connector or ECG connectors. So for these brands, these are connectors, and for this, these are the ECG connectors. And also you have a keypad where you can be able to navigate through. For this brand, this is a keypad, and for this brand, the keypad is where you're seeing the arrows and the F1 up to F. These function keys for this brand, the F1 up to F4, they're the ones that helps you to select what you want to simulate or which area you want to go through the LCD and whatever you see there. So we have our patient monitor here, and we're going to use this to be able to simulate whatever parameters we want. So I will turn on the patient monitor. All right. So with this props that we have on this patient monitor, we have the ACG prop and we have the ECG. So since the ACG2 is one that you can use, let's say on first oximeters, you can use it on this. And now I'll just make use of the ECG. So before you turn on your simulator, you have to make sure that you have already connected the leads from the ECG sensor or the ones that are meant for the ECG. And here mostly we use color codes, or we can even use the labelings on your leads or the connections. So I'll start connecting. So in this case, we have this one, which is for the right arm, and it's also white in color. So like I said, you can use the color codes and then you can check where the white is. And so connect it here. And then have the black one, which is for the left arm. And then I'll check where it's written left arm. The brown one, also it's V, and I'll check as well where it's labeled V. So we have V1 up to V6, which is just showing us different sides of getting the signals when you connect it on the patient. So I can choose to put it as, let's say, V2. And I have another one that is for the left limb. And I'll connect it here. And the last one is for the right limb. And then when I check, connect it here. So once I'm done connecting, I'll then turn on the simulator. So for this model, it will show you loading and some sort of percentages up to 100, and then it will show you the menu or where you can navigate and check other parameters. And for the other brands, it might not even take long about the loading and stuff. It will just go straight to the things that you can try to simulate. So when you get here for this model, it will show you the keys, and the keys are the same keys that we have here. But then since this one is, it has a touchpad, you can also use the keys on the LCD. And when you use these arrow keys, there is the down, up, and the sideways. If I go to the left, it's giving me different numbers. There's 1, 2, 3, 4, 5. But then I can choose to clear this and also move to the other tabs. So there's a tab for wave, whereby it's going to show me the waves that are being generated when I've connected my ECG. And when you go to the list, so on the list, that's where now it acts as our simulation. You find a list of things that you can simulate. And then these things are given numbers, because when you check on number 1, you can see that there is few settings. You go on number 2, you find ECG rate, and you can also try to just click on what you want. So to place OK, you use the yellow one, the yellow banner, which has an arrow. This symbolizes enter. So for example, I'm on 2, which is the ECG rate. So when I click OK or enter, I can now see the ECG rate, which is at 80 beats per minute. So this is the value that is precise, or the one that I had to find even before I adjusted anything. And whatever it is that is in this simulator, or is said in this simulator, is what you're seeing on your patient monitor. So you can see for the heart rate or the ECG rate, it's showing 80 beats per minute on your simulator as well as on your monitor. Then I can choose to adjust it. So if I go up, I can change it. Now it is on 0. It's now on 20 beats per minute. It's 140 beats per minute. So if I click enter, it's supposed to even change on my monitor. So since the ECG rate is giving me 140 beats per minute, and this is not normal for a patient to be having 140 beats per minute. That's why now you're seeing the monitor itself is giving out alarms, or it's being activated that there's something wrong with the patient. So these are the things that you're supposed to see inside the alarm. But then if I try, let's say, to reduce this, to put it in the normal ranges, let's say 60 beats per minute, and then I click OK, the monitor itself also has to adjust and reduce to 60 beats per minute. So as you can see, the readings are changing. And now we are on 60 beats per minute. All right, so you can clear that and also change. So I can also try to change, let's say, the amplitude. So if I check, my amplitude is showing me 1 millivolts, but I can choose to increase or decrease it. So all right, so I've set the amplitude at 2 millivolts, and then I have now placed enter, which is okay. And it doesn't matter whether I change the amplitude, in as much as at first it was at 1 millivolts and now it's at 2 millivolts, but I'm still getting the same results. So these are the things that you're supposed to check, and you also have to navigate through. So like I said earlier, it doesn't matter the amplitude, it doesn't matter the things that you are trying to check or navigate through. But then if your device is working properly, it's still supposed to give you the results. And if you are done, you can actually clear and you can switch it off. So just to say the same about the other simulator, like I said, if you turn it on using this tab, it will switch on, and then it's showing you different functions. There's ECG, respiration, BP, based on the F1, F2, F3, F4. So if I choose F2, which is the respiration, it's going to give me whether I want to know the wave, the rate, and I can also choose, let's say, the rate. And the F1 here is standing for now 15. 20, and they can also navigate through and choose the same thing. So it's almost the same as long as you know how to go and navigate through the different parameters that you have. That is all we had for you, and it's now time to allow the host to take us to the next stage of our presentation. Thank you very much.
Thank you so much for the wonderful live demonstrations. The floor is now open for questions. So you can either raise your hand, I'll mention a name, I'll give you the floor to ask the question, or you can type the question in the chat and I'll read it out for our engineers to answer the question. Thank you.
All right. So I saw a question. From Kabor, if I've pronounced your name properly. You said you use a proxy science simulator from Fluke to calibrate patient monitors, but you find it difficult to navigate on the non-invasive blood pressure test and the source test. How do you go about it in case we have come across it? All right. So what I would say is, first of all, I don't know how you go about it, but before you do a pressure leak test on a monitor, you will have to do it first without the monitor to identify the rates of the leakage that is there. And also, you have to use this leak rate to offset the rate of the full system with the monitor connected to it. So what you need to do first, when it comes to the model that you just mentioned, on the screen, there's a tab for the A9BP, and then when you place on the test software, it will definitely take you to the leak test. So on the leak test, you can try to either increase or decrease the value settings. You can try to highlight what you want. And when you click enter, it's supposed to show you the non-invasive blood pressure leak test or the results that appear on the screen. I don't know if that is making any sense. But then also to make sure that you get the recommended information, you can also use the manual itself, because in the manual for the brand that you're using, they actually explain everything on how to go about the leak and the source test. Yeah, I think that's what I can say for now. If you need more information, you can just email us, or you can type in your email so that I send you a proper answer on that. Thank you.
All right, thank you so much for that. I hope she has answered your question. And our next question is from Mason. He's asking, how often am I supposed to use the simulator to calibrate patient monitor?
All right, so usually they advise that you should check them annually. So so once every year is fine, that's a recommendation. But if you want to do them as often as possible, but annually is what is recommended. Thank you.
Thank you so much for that answer. Next question is from Numa Michael. I am Numa Michael, a biomedical specialist from South Sudan. As a new person in this position, my hospital lacks most of these tools. What model do you think I can recommend for my facility from your experience?
All right. So to answer your question, we do not support any brands. So these are the decisions that you as a biomedical engineer or the maintenance department of your facility have to decide. So like I said earlier, I gave you the factors that you need to consider when you want to have your simulator. So those 5 points or 5 factors should help you to determine what kind of simulator you can have, or which brand or model you have to go with, based on the needs of your facility or the needs of you as an engineer when it comes to monitoring or assessing the performance of the simulator or the patient monitoring devices that you have. So we don't support any brands. Any brand is okay based on the needs that you have. Thank you.
Thank you so much for that, Janet. I'll give the floor to Aubrey. I hope I'm pronouncing your name right. Forgive me if I've mispronounced it. Over to you.
Okay. Thank you. I'm Biomedical from Ethiopia. My question is, in most of hospitals found in our country, there is no such type of toolkits. So if there is any means we can get, or how we can get these toolkits in hospital. Also, it is not found in our country, I think in our market. So is there any means to get these toolkits at this availability? Thank you.
All right, thank you. Thank you for the question. I think most of the devices can be found online if you try to order them. That's what we've done to access the monitor simulators. So maybe you can also just try that and try to see if the online markets have these devices, and just try to order if you do not have them in the country or in the region. Thank you.
Thank you so much, Aubrey, for that. Next question is from Jatangwa Collins. I heard about accuracy when you mentioned about the error curve. Briefly explain again what the error curve does. I missed that. So I think this was presented by Janet. Janet, please take over.
All right. I've heard your question. Of course, I'll not go much into details because of time, but then we'll post the recording of this presentation on YouTube on Oxygen Alliance page. That's YouTube page. But then just to answer you, the RFQ calculates the SO2 levels based on how much light has been absorbed at different wavelengths. So we're not talking of the other caves, mostly we do with calculations. The brands that you have, the models that you have, definitely have pre-calculated RFQs. And it's the ratio of the ray and infrared light that is being absorbed, and then it calculates a number. And that number is the one that is represented in each and every brand or model. So when you're simulating, you have to make sure that it matches the RFQs, or you can even have different settings, but you still have to get the same results. So it's just there to give you the recommended values for this structure. Thank you.
Yeah, just to add on what Janet said. So the software that is in the SPO2 simulators, because when you're talking about the R curve, it's specific to the SPO2 simulator. It has preset values. So for example, for like if you have SPO2 90, if you have SPO2 98, the R value is something else. So it's mapped for each and every SPO2 value. So it's going to basically, when you're doing the measurements, it's just going to refer to that curve that is already set by the manufacturer. It will not be doing the calculations right there. It's like the curve is already incorporated in the firmware. So the curve, you heard right that the curve is going to influence the accuracy, and you need to really make sure. So it's just the ratio of absorbance between the red light and the infrared light. So that's the main thing about the R curve. Thank you. Back to you, the host.
I'll take the last question for today. The question is from Mason. What would be the consequences of powering on simulator before connecting the electrode?
All right. So like I said earlier, you're supposed to connect first before you power on. The reason is the moment you connect the electrodes on your simulator, it will start taking the signals, and then those signals will be now shown on the monitor. So these are the cases where you more like confuse the system, because it starts giving out the readings that are not supposed to be the case. So when you have already connected and then you turn it on, it starts right away simulating all the signals based on what you've connected. So in the cases, for example, I have and then I connected maybe between the left arm and the right leg. It will start giving me the results even before I continue with the other leads. So that's the more reason you have to start to connect first and then you turn it on. I hope I've answered your question.
Thank you so much. for your questions. I hope we've learned a thing or two. This marks the end of our content. Thank you for being a wonderful and interactive audience. We hope to see you in our next talk. And as I finish, I'd like to remind you about the announcement we made earlier about the Biomedical app, which will be launched on the 20th of November this month. And please, if you haven't already, drop your email to the chat so that you receive the notification. If you have further questions, you can send emails to us at info@oxygenalliance.org. Thank you for your attendance. Goodbye.